Hi there. Welcome. And yes, perfect. So you've already gone through the questionnaire diagnostic portion, correct? Perfect. So the technician should have brought you in from down the hall, and this portion will just be the cranial nerve exam. The reason that we do the cranial nerve exam is just to make sure everything is kind of functioning as it should. And that's because with the simulation, there's a lot of emphasis on colors and scents and sounds and just a little bit of everything. It's a full sensory experience. So we just want to make sure that everything is how it should be, or if you have any kinds of outlying situations such as color blindness that we know, and so we can program the simulation to be still a comfortable and full experience for you. So I'm just going to go through our array of tests. Have you ever had a cranial nerve exam before? You have. Perfect. So you kind of know how this is going to go. First, I'm going to do a sight test. So I just like to look into your eyes and just kind of make sure everything looks good. And then we're going to do a follow the light. And there are no reading. There's no reading in any of these simulations, so we don't need to do a distance test. Everything will be up close. So I'd like to do that, and then I'm going to do a quick color test as well, just to make sure you can see all the different colors. Yeah. Okay. Then we'll move into our other tests from there, yes. Are you ready? Okay, so first I'm just going to take my flashlight on my phone and kind of look into your eyes. So I'm going to get closer to you if that's okay. Just kind of look into your eyes and look to make sure that there's no kind of spots or cloudiness. And could you look up that way for me? Okay. And can you look up the other way? And now can you look just down, just straight down? Okay. So your eyes look good. I'm actually gonna pull this back out again. Now I'm just gonna ask you to do a follow the light. So first things first, you'll just follow the light. And try not to move your head too much. Okay. Now I'm going to ask for you to look right at my nose. And I'm going to move the flashlight around again, yeah. Okay. Now I'm going to do one more thing before the color part. And I'm just going to take this pencil and I'm going to move it around, and you're going to tell me when it leaves your field of view, okay? Alright. Okay. Okay. Alright. Okay. Do Perfect. So everything is looking good so far. Now I've got this collection of colored pens. I'm just going to show you one at a time, and you're going to tell me what color it is, okay? And what color is this? Yes. And what color is this? Perfect. How about this one? Perfect. And this one? Exactly. And let's see. Perfect. Yes, it's pink. And let's do one more. Yes, that one's just white. Perfect. You are clearly able to see color just fine, so that is a big part of the simulation process because each chakra is connected to a specific color, so everything in a specific simulation will be specifically tailored to that color. Okay, so next let's do your olfactory nerve test next, okay? For this one, I have some essential oils, and I'm just gonna hold one under your nose, and you're gonna tell me what you smell. Many of them are very recognizable, but there are some that are not. But it's okay if you we have a good idea of what someone would recognize versus what someone wouldn't. So don't worry about getting all of these right. We just kind of want to test to make sure that you can really tell a difference and identify the ones that you should be able to. Alright, are you ready? Okay. Let's see. This one. Let's do this one first. Just inhale. Yes. That one is peppermint. So, mint is close enough. And they'll go through this more in depth, but peppermint is good for the chakra simulation. Your second chakra, your sacral, which is creativity, they'll go through it all, and your throat chakra. So just a fun fact in case you're interested, all of the ones that you'll smell today do also have a couple chakras associated with them. Yes. Okay, next. Yes, that one should be fairly recognizable. It is orange, you're correct. And orange is good for your heart chakra. Okay. Next one. Yes. That one's a little bit more difficult, but you got it. It is lavender. Lavender is also good for your throat chakra and also your third eye chakra. Next one. That's lemon. Lemongrass officially, but lemon, yes. Lemon is good for your third chakra, which is your solar plexus, and that has to do with your confidence. I've got one more for you. This one might be difficult to guess, so don't feel bad if nothing's coming to you, but just take your best guess, okay? Yeah, it's a little bit difficult. What does it kind of maybe smell like to you? Like some lotion? Yes, this one is eucalyptus, which is in some lotions and medicines, like with aloe, you know. So, yeah, that one was one of our harder ones, but it does go with the throat chakra. So if you like the scent, it's to help with the throat chakra. And there's one more that I'm not going to have you smell just because, as you've been told, there are cats in all of our rooms. And the final scent is tea tree oil, which is for your root chakra. But I just wanted to share that fun fact with you. And if you don't know, cats and dogs are allergic to tea tree oil, so we try not to have it. It will be in your simulation, but just not in the actual room. Okay. Next, I'd like to do a taste test with you. And so I've got 4 of these. Just little cups with about an inch or so of a clear liquid in the bottom. Each liquid has a different flavor in it, and these will be pretty basic taste profiles, so sweet, salty, sour, spicy, that type of thing. Yeah, it's pretty, definitely should be recognizable. We won't have like specific foods in here, specific food tastes. Okay, and I am just going to, I've got 4 Q-tips. I'm just going to dip it in the water and then touch it to your tongue. Is that okay? Alright. We'll do this one first, so I'm just going to get a little bit closer to you, okay? Okay, so first one, here we go. Just going to touch it to your tongue. And what taste is that? Yes, it is sour. Okay. Now I'll grab the second one and a clean Q-tip. And here we go. And I'll just touch that to your tongue as well. And what does that taste like to you? Yes, that is sweet. Now, grab another cup and a clean Q-tip. And we'll do another one. And I will just touch that to your tongue. And salty, that's correct. Now last one, let's grab another. And here we go. Last one. And I'll just touch that to your tongue. Yes. That one is spicy, but it should be very, very mild. Do you need a drink of water or anything? You're okay. Cool. Alright, so the next thing I'm going to do is a sound or hearing test. I'm going to do some sounds on both sides of your ears, and you're going to tell me which side I'm doing it on first, okay? Okay, here we go. Yes. Yes, that was both. Okay. Yes. Yes. Perfect job. That was great. I even tried to trick you quite a bit, so you did a very good job with that. Next thing I'm gonna do is I am going to do a different type of sound. So I'm going to be making a softer sound, and I'm going to be making a harder sound. And if you wouldn't mind just closing your eyes. And now tell me if I'm making a softer sound or a harder sound. Perfect. Yes, that was harder. Softer, yes. Next. Perfect. Yes, harder. Perfect. Yes. You can open up your eyes now. And now, music does play a big role in chakras as well. So I'm just going to do a very quick pitch test. So I'm just going to hum a note, and then I'm going to hum a second note. And you're going to tell me if the second note is higher or lower than the first note that I hummed, okay? Perfect. All right. Was that higher or lower? Higher. Good job. Next one. Good job. Mm-hmm. Mm-hmm. Yes, that was the same note. Good job. Now I'm going to do the same thing, but I'm going to do a smaller interval so it won't be as big of a jump, but I want to see if you can still tell, okay? Alright. Mm-hmm. Yes. Mm-hmm. Good job. Alright, and it sounds like you can hear music fine. Finally, I would like to do, I guess this last one comes in two parts. So first I'm going to do a tactile test. So I'm just going to use the same pencil from earlier, okay? I'm going to touch your face gently with both of these, but gently with the eraser side and also with the pointy side. And I just want you to tell me if it's the eraser side that's touching you or if it's the pointy end, okay? Alright, so I'm going to get a little closer to you again. Okay, so I'm just going to... Perfect. Pointy, yes. Pointy. Blunt. Pointy, yes. Pointy, yes. And pointy, yes. Okay, good job. That was perfect. And lastly, I'm just going to do a muscle test. So it's just general muscles that you should be able to work with. It's nothing strength related. So I'd like you to give me a smile. Perfect. And now I want you to frown or pout or whatever. It's not what I was doing. Perfect. Next, I'd want you to open your mouth wide like you're yawning. And then do like you're saying, ooh. Okay, perfect. I already adjusted your eye muscles, so. Okay, one last one. I'm just gonna hold your hands. Put yours in between mine and try to push them outwards, okay? Okay, one more time. Okay, and now I'm gonna push outwards on your hands and try to keep me from doing it, okay? Okay. Yeah, you do have muscles as well. So, perfect. Okay. So in that case, everything looked really good with your cranial nerve exam. So I'll go ahead and get the technician to go and take you to your suite for the evening, okay? And the technician will also help put you to sleep. It's a little bit like an anesthesiologist kind of situation, but it's a lot more gentle in terms of what they'll give you to help you fall asleep. And a lot of it we try to keep as natural as possible, so ideally you'll fall asleep naturally, just with what they do and what they give you. But she will also walk you through what you can expect in the upcoming simulations as well. Yeah, by that time they'll have enough time to analyze your diagnostic results, so they'll have a better idea of what you can expect there, okay? Alright, well, it was lovely meeting you, and I hope that you enjoyed the simulations.